now we are ready. So this is Dr. Ling Li, and she will be speaking about Alzheimer's. And then again, remember, anything that you kind of find interesting, want to ask questions or are unsure about, go ahead. And Dr. Li, thank you. Let me get that ready for you. All right. Would you like this on? Yeah. Okay. Turn it back on for you. There you go. All right. Thank you.
Well, thank you very much, Teresa, for the introduction, and good morning, everyone. Looks like you already, two speakers in front of me already prepped our talk. So thank you, first of all, for giving me this opportunity to share with you and talk about Alzheimer's disease. Let's see, I think we all, yes, it's, little bit about myself. I'm from China. Grew up there. So my hometown is on the east coast of China, just north of Shanghai. So high school, I was really, into math and chemistry. So dreaming someday maybe becoming a scientist and an educator. So that was at the time, and I think I was extremely lucky. So if you guys are reading a little bit history about China, and maybe you're too young, but I want to tell you, I was extremely lucky in my last year of high school. So China reopened the university examination after closing for 10 years. So that was just happened, and then, the timing was good. So, and I was one of the, I guess, the 3% of the high school graduates in the past 10 years, and then got admitted to the 4-year university. Even though at that time, we didn't have really much of the freedom to choose what you want to do or which school you want to go. But again, it was extremely, I was extremely thrilled to have this opportunity. So I was the first college student in my family, and I was sent to a university to study veterinary medicine. Again, this is not my choice, because we didn't have one, but I truly enjoyed all the life science related courses. So we made the best time in the college, and then I was extremely hungry for knowledge, and so after the college, I went to the graduate school for master's degree, and then hungry for more knowledge and also some hands-on research experience. And during that time, and including the college, I was determined I need to learn English well. So because this will give me an opportunity to study abroad, to explore more of the world. And fortunately, I earned a scholarship and then went to Iowa State and received my Ph.D. at Iowa State in molecular biology. So from there, you can see that I continued into my postdoctoral training at the Rockefeller, mostly focusing on, in the beginning, was cholesterol metabolism, cardiovascular disease. But then I also moved to University of Alabama, Birmingham, and that's when I got more interested in the neurobiology of Alzheimer's disease. And from there, I established my own laboratory, and then focusing on the connections between Alzheimer's disease and cardiovascular disease. So about 10 years ago, I was honored to be recruited to University of Minnesota. So currently, I'm a professor and also the VFW and down chair in the pharmacotherapy for the elderly in the College of Pharmacy here. So what do I do now? We're trying to, of course, better understanding Alzheimer's disease and hopefully find treatment, effective treatment for this terrible disease. And at the same time, I'm an educator, so I'm training and mentoring graduate students and then also teaching in the professional PharmD program, so the professional pharmacists. So this has been a long way. You can see my journey here, but I would say that the only important thing in the career is that you need to really grab the opportunities, to just keep on going. Maybe you don't have absolutely, the free choice, but my husband, also a scientist, so we often discuss this. He said, if I did have a choice to, decide exactly what I would be doing, and after pause for a few seconds, I said, I probably would do exactly what I'm doing now. I would be still, be a scientist and an educator. So I think things will usually work out well if you keep going, put your effort in the direction you're going. All right, so much for myself. So what we're going to talk about today, so time is limited, but I'm going to give you a very brief introduction of Alzheimer's disease, and then take a look at what's the current understanding of the etiology and the treatment for Alzheimer's disease, and then share a little bit with you what we do in our laboratory. And then at the end, I'll give you some of my own perspectives of future of Alzheimer's disease research. Okay, so Alzheimer's disease is named after a German doctor named Dr. Alois Alzheimer. So he described the first case of Alzheimer's disease over 100 years ago. So what do we know about the brain? What's happening in the brain? This is a very simple picture. This is just a cross-section of the brain, and clearly you can see a normal brain with full of the brain tissue, but here with the Alzheimer's brain, you can see lots of brain tissue, and especially already the doctors already presented before, with the hippocampus, which is really extremely important for learning and memory. It's really get atrophy or shrinked in size. So under the microscope, this is the first Alzheimer's patient discovered by Dr. Alzheimer. And then people later, again, go to his basement and found the brain section and then stained for, these sections. And the two hallmarks of pathology happening in the Alzheimer's brain is called amyloid plaques and neurofibrillary tangles. So the plaques, as you can see, these are here, but this is particular silver staining, and these are particular protein called beta amyloid protein, or amyloid beta, or A beta people call. And then the tau, the tangles, is the protein called tau. It's inside the neuron. These are very magnified pictures of tangles. So this is what happens when you see them, and this is what Dr. Alzheimer reported 100 years ago. So here I also like to share with you example, how this devastating disease actually take away the people's ability. So this gentleman's name is William Wurtmalen, and he was an artist. What he's good at is drawing himself, the self-portrait. And you can see this is when he drew himself when he was complete normal, young. And then in 1995, he was diagnosed with Alzheimer's disease, and he decided, using his own unique ways, to show people how this disease actually rob of his abilities. And as you can see, this is 5 years after he was diagnosed with Alzheimer's disease. This is how he portray himself. And a year after, all he could do is a circle. He had no idea where to put his ears and mouth, so he quit. And then you can see he unfortunately died a few years later. And we all know some of the patients with Alzheimer's disease, they would even lose the basic, like daily living abilities, and not recognizing their closest family members. So this is extremely devastating disease. We know a lot about what's happening in the brain, what changes in the brain, but really we still don't fully understand the disease. And as a matter of fact, the biggest risk factor for Alzheimer's disease is aging. So as you can see clearly here, with our aging population, and the number of Alzheimer's disease in 30 years will be more than doubled than what we have now. Currently, we have about 6 million, and as you can see, the number is going to be steep, and especially with the aged elderly people. So the good news is that in the past 30 years, we actually learned quite a bit about the genetics, and especially some of the rare forms of Alzheimer's disease and dementia in the families. And so you can see this is plotted to show you that some of the genes, if the mutations you have, the mutations here is absolutely going to cause Alzheimer's disease, but it's extremely rare. And the ones that are more commonly in the general population actually associated with significantly increased risk of Alzheimer's disease. One of these genes or producing the protein is called apolipoprotein E4, or ApoE4 for short. So I will come back to this a little bit later to tell you a little bit more about this. This is a protein which is involved in cholesterol metabolism. So you kind of can see how my career started getting into Alzheimer's disease, right? Started to studying cholesterol metabolism. Okay, because all these genes, the mutations I showed you in the families, they all increase one of that, the plaques we saw, the amyloid or A beta protein. So, scientists, when they have this and, these phenomena, we propose a hypothesis to explain the disease. And the scientists are often very strong opinion. So sometimes it's like a religion, right? So for people who believe the amyloid protein or A beta is the most important thing in the disease development, this proposed amyloid cascade hypothesis believes that the genetic mutation and all the other risk factors all causing the A beta. So these people, because they have so strong belief and being actually referred to as the Baptists. Okay, so the Baptists believe this is the most important process in the disease and leads to the neurotoxicity and kill the neurons, so then eventually cause the dementia. And as you can see, the neurofibril tangle, this is the tau protein. It seems like just a side effect here. Okay, of course, for people who believe tau is the most important thing, or tangle, this is not acceptable, right? So they believe the tau dysfunction is in the middle of everything. And I used to see a lot of interesting heated debate and crossfire between the Baptists and Taoists. But nowadays, with the research going on, turn out to be both of them are important. They play synergistic roles, and amyloid most likely in the early stage, and then leads to the tau or tangle pathology later in the disease. All right, so I need to go fast. Basic science is trying to figure out the disease development, the mechanisms, but the physicians need the drugs, right? So this is what we have, for quite some time. Some of the drugs available to treat Alzheimer's patients, but they really asymptomatic drugs. They only help some patients and not always work. And not until earlier this year, there's a potential FDA through this accelerated approval process with the antibody, with the immunotherapy targeting to that amyloid. However, this has been controversial because this has not been in clinical trial to absolutely improve the functional outcomes. So we will see with more of the application of this drug, what will happen in the reality. So fortunately, in the pipeline, we have different drugs under development, and some of them are the Baptist belief and targeting A beta, and some are the Taoist belief and targeting the tau and tangles. But others, of course, are more general into anti-inflammation, cholesterol modulation. And remember, this is ApoE. This is a very significant risk factor. And this is also becoming a very attractive target. So as you recall, this is important. So in humans, we are unique. We actually have 3 types of this gene, or the alleles. So E2, E3, E4. Most of them, hopefully, we all have like ApoE3. It's most common, and then this is a neutral risk for Alzheimer's disease. But the problem is that with the ApoE4, it's increased risk of Alzheimer's disease. And good news is that some of the folks have E2 that will be protective. And you can see not only increase the risk, but also people who carry the ApoE4 gene also have earlier onset. So the research have shown that this ApoE affects, amyloid aggregation, clearance, also the tangle formation. But importantly, remember, this is a cholesterol lipid transport protein, and this is actually play an important role in cholesterol metabolism and cardiovascular disease. And that leads to my own lab's focus into that and focusing on the connection between the cardiovascular disease and the Alzheimer's disease, and particularly on the lipid and cholesterol pathways. What we believe is whatever is good for the heart is also good for the mind. What we want to do is learn all the successful lessons we learned from cardiovascular disease and to defeat Alzheimer's disease. I won't have time, but these are the projects we have ongoing. And as you can see, mostly we're trying to rescue the deficits of ApoE4 using like good cholesterol called HDL and others. And at the same time, recently we also developed the projects to do the SARS-CoV-2, this COVID, and how that relates. You all heard about long COVID and brain fog, and this is where we have started. And what we do, we use the different models, and then as others have shown, mouse models, human brain tissues, postmortem, and cell cultures, and even nowadays we use brain organoids and treated, to do genetic modification or drug treatment, and then followed with all the functional or molecular mechanism studies. So with that, in conclusion, I guess we made a lot of progress, but we still have a lot of challenges. But there are good news is there are many promising drugs in the pipeline. And then I want to also point out that we do have a national plan to defeat Alzheimer's disease that was signed into law by President Obama in 2011. One of the goals is to prevent and defeat Alzheimer's disease by 2025. I'm optimistic the goal will be achieved. To end my talk, I want to take a message from the first Chinese textbook over several thousand years ago, but I think it still holds true for today. So as you can read here, superior doctor prevent the disease, a mediocre one treat the impending disease, and then the inferior doctor is treating the disease. So I'm sure we all want to be the superior doctor, so hopefully we can prevent the disease to happen. So lastly, but not the least, I'm really grateful and fortunate to work with a group of talented people and wonderful collaborators, and I'm very grateful for all the research support that we have received over the years. With that, thank you very much, and then I'll be happy if there's still time for some questions.